Analysis of sputum expelling equipment. Sputum discharge equipment is an important tool in clinical nursing to help patients clear respiratory secretions and improve respiratory function. Ruojiong medical expectoration equipment mainly includes Ruojiong medical vibratory sputum excretion machine, Ruojiong KD airway clearance device. The following Ruojiong medical analysis from the working principle, the applicable population, the use of precautions and other aspects. Firstly, Ruojiong medical vibratory sputum excretion machine. 1. How it works. Ruojiong medical vibratory sputum excretion machine using the HQO technology, the vest inflates and deflates the air through pulse signals to produce high-frequency, low-amplitude movement, which uniformly acts on the entire chest wall, causing the patient's airway and lungs to undergo autonomous vibratory airflow and directional drainage, prompting the respiratory tract and the deep secretions of the lung lobes to relax, liquefy, and dislodge, so as to make the sputum move from the bronchial tubes to the main airways and then discharges the phlegm out of the body through coughing or artificial attraction. The sputum is then expelled from the body through coughing or manual suction. 2. Suitable people. Long-term bedridden patients, such as postoperative recovery, neuromuscular disease patients, respiratory impairment, chronic obstructive pulmonary disease COPD, bronchiectasis, atelectasis, etc., phlegm-producing difficulties, such as elderly patients, children, patients with myasthenia gravis, etc. 3. Use your strengths. Easy to operate. After the patient wears the vest, the device automatically runs without manual back padding. High comfort. Adjustable vibration frequency and intensity to reduce patient discomfort. The effect is remarkable. It can cover the whole lung area and promote the deep sputum discharge. 4. Use precautions. Contraindications. Contraindicated in patients with pneumothorax, rib fracture, pulmonary bullosa, hemorrhagic disease, etc. Parameter adjustment. Select the appropriate frequency, usually 1025 Hz, and pressure according to the patient's age and condition. Observation response. Patient's vital signs should be closely monitored during treatment, and abnormalities such as chest tightness and shortness of breath should be stopped immediately. 5. Equipment parameters. Screen size, 10, 1-inch touch screen. Functions, oscillatory expectoration, nebulized inhalation, negative pressure suction. Pressure range, 038 kPa. Step 0.1 kPa, 3 units. kPa, mg/am, cAMH2O. Frequency range, adult 125 Hz, pediatric 115 Hz. Step 1 Hz. Therapy mode, auto, manual, customized. Automatic mode, 5 options. Pediatric 0 to 7 years old, pediatric 7 to 15 years old, adult slim and weak, adult average, adult plump. Manual mode, pressure and frequency can be adjusted at any time during treatment. Customized mode, pressure, frequency, and time can be set for each session before treatment, and 10 customized modes can be stored. Time range, auto, 10 mins, manual 1 to 60 minutes. Adjustable, customized 1 to 60 mins. Adjustable, P power voltage, AC 220 volts 50 Hz. Secondly, Ruojiong KD airway clearance device. 1. How it works. Ruojiong KD airway clearance device using the ME mechanical positive and negative pressure sputum removal technology that conforms to human physiology. By applying higher positive pressure during inspiration and instantly switching to negative pressure during exhalation. The difference between the positive and negative pressure is used to generate higher expiratory flow rate in the airway to replace the coughing action or enhance the coughing effect and generate an effective peak coughing flow rate to bring out secretions. Positive pressure ventilation dilates trachea and bronchus, loosens secretions clogged. Filling the alveoli increases the intraalveolar pressure. Negative pressure exhalation. The airflow in the lung is discharged at high speed, pushing the secretion block to the atmospheric tract and the head side, and discharging the deep lung sputum. Percussion mode. Through high-frequency oscillation, positive pressure ventilation, lung re-expansion treatment, and lung function exercise. Variable duty mode. Superimposed oscillation percussion during breathing reduces man-machine confrontation and increases lung swelling treatment effect. 2. Suitable people. Any patient who is unable to cough or whose cough peak flow rate 270 liters per minute and not effectively clear airway secretions. Patients with artificial airway and mechanical ventilation. Patients after surgery reduced cough function due to pain or anesthesia, etc. Patients with cough and weakness after extubation. Patients with neuromuscular diseases. Patients with respiratory diseases and sputum disorders. Patients with trauma who should not use external percussion and need to expel phlegm. Pulmonary convalescent patient. 3. Product advantage. Non-invasive and comfortable, it directly acts on the airway to expel sputum from deep lung. Non-invasive patients mask, mouth bite, and artificial airway patients air insertion, air incision, reduce lung infections and shorten the length of hospitalization. The operation is simple and convenient, and the single treatment time is short. National Uniform Charge Code. The same brand supporting disposable special consumables. 4. Use precautions. Contraindications. Pulmonary bulla, pneumothorax or mediastinal emphysema, acute lung injury, ALI, acute respiratory distress syndrome, ARDS. Patients with severe heart disease, hemodynamic instability, and no suitable monitoring conditions. Within half an hour after meals, patients who do not cooperate during non-artificial airway therapy, and tracheomalacia should be relatively contraindicated. Parameter adjustment. Positive and negative pressure values should be set according to the patient's vital capacity, compliance, and other indicators. Operation training. Only professional medical personnel can perform this operation, who avoid air pressure injury caused by improper parameter settings.